Hi everyone, my name is Daniel Nwoke, and I'll be looking at the effect of 24-month physical activity intervention that was done versus a health education on cognitive outcomes in sedentary older adults. And I would like to introduce what randomized control trial is. In randomized control trial, what we're looking at is a trial that can be used in a number of different contexts, although they are mostly used in laboratory or clinical settings. And what it does is it aims to minimize the effects of confounding, particularly so-called confounding by indication, and its understanding helps in treatment and developing models and validity around its delivery so that we're able to understand the best intervention approach of a particular study, and we're able to evaluate it. And ROCTs, or randomized control trials, are an experimental form of impact evaluation so that a population receiving the program is selected, and at the end of it all, they are evaluated with a particular design or study method. And on my study that I'll be looking at, as life expectancy in the United States continue to rise, the maintenance of physical independence among older Americans has emerged as a major clinical and public health problem. Therefore, we need efficient and reliable movement, and older people who are losing their mobility are less likely to remain in the community, and they have higher rates of morbidity, mortality, hospitalization, and they also experience poorer quality of life. And several other studies in the past have shown that physical activity improves physical performance, but definitive evidence showing that mobility disability can be prevented was actually lacking. Therefore, the life study, which is this study we are looking at, is a phase 3 controlled randomized trial, which was actually needed to fill this evidence gap that was lacking. And based on this trial, it was a multi-center phase 3 randomized clinical trial that was designed to compare the physical activity of 1,600 sedentary older persons for an average of 2.7 years. It was actually coordinated in various centers like University of Florida, University of Northwestern University in Chicago, and also University of Florida. And the aim of this study was to evaluate so many outcomes, compare them and their components on their validities, and also come up with a proper evaluation outcome. And physical activity of the study was actually was one of the components that was significant. And the primary outcome of the major mobility disability was defined as inability of these patients to be able to complete a 400 meters walk in a test of 15 minutes without sitting down or without the help of another person or a walker. And when these patients were not able to measure this possibly, therefore, a combined outcome of major disability and disability in activities and daily living was actually brought up. And the assessment of major disability, we're looking at participants being able to have physical activity intervention done primarily by asking these participants to walk for at moderate intensity, lower extremity resistance exercises were done. Balance exercises were done, stretching, behavioral counseling was done as well. And the trial provided definitive evidence regarding whether physical activity is effective and whether it is practical for preventing major mobility disability. The results actually had crucial implications for public health prevention in a rapidly aging society. And the study also yielded valuable information concerning the efficacy and effectiveness of physical activity across a broad spectrum of important health outcomes. On the objective of the study was to determine whether at the space of 24 months, physical activity will result in better cognitive function and lower the risk of mild cognitive impairment. And again, it was a randomized parallel control trial. And the physical activity aspect focused on walking, strength, balance, flexibility training. And the intervention was done so that at the end of it all, uh, the study will impact both the clinical practice and the public health policy and also benefit individuals and the society. And based on the methodology, you could see that the health education arm of the study actually involved in-person group workshops, and the session were comprised of 60 to 90 minutes of interactive and didactic presentations, including approximately 10 minutes of group discussion. So it was being compared to physical activity exercises. And randomized control trials are increasingly becoming popular, you know. And on the side of the uh, data I generated from this study, we'll be looking at my worksheet. And on objectivity, what you see that questions like, are the study methods and procedures adequately described? Study data retained and available for reanalysis? I made a summary, and I noted that the findings were well appreciated and regarded as reliable because it presented a favorable image of physical activity when compared to health education. However, there were several limitations. And first of all, even though cognitive function and mental cognitive incidents and dementia were prior outcomes of the life study was not specifically powered for these outcomes and may have been too short, to affect incidence events. And when you look at the internal design validity, you could also see that I left a summary where I said good internal validity was denoted according to the trial, and it was linked to differences between the two arms or the groups. So we are comparing the physical activity arm and comparing it to the health education arm. And the health education arm indicated that there was a decrease in mobile mobility disorder at the end of the study. And cognitive decline was actually attributed to the intervention rather than to other variables like age, sex, or medication use. The design that was used in this study were intimately related to the internal validity of a clinical trial, although internal validity was actually a little bit threatened by the bias and random error as well. And when you look at the conclusion validity, what I had here is that based on my assertions and my scores, the statistical estimation of the study was impacted and weakened by the lack of baseline comparison group data. And many other health variables and social determinants of health, when applied to improve the study, showed no significant improvement. And on the construct validity, valid measurement of physical activity is important for studying when you want to study the risk of morbidity and mortality. And the purpose of this study was to examine evidence of construct validity of two similar single responses. When you look at the utilization, the findings were considered very useful for the participants in the physical activity group who were 80 years and above, and their cognitive function remained stable over 2 years for all the participants and were used to support the proposal to fund a larger second phase of the study. And when you look at the operational problems and the overall assessment of the study, you would see that randomized control trials are increasingly popular in the social sciences and not only in medicine. We can argue that even in the public and sometimes researchers put too much trust in randomized control trials. However, other methods of investigation are actually out there. And contrary to frequent claims in the applied literature, randomization does not actually equalize everything other than the treatment in treatment groups and control groups. And in this case, the physical activity group when being compared to the health education group. And randomized control trials for this study were for the life study actually did not result in better global or specific cognition when you compare it to the health education program in older adults. And there was actually other strengths of it, like high retention rates and others, which did not really prove well. And cognitive function and dementia were other outcomes of the life study. However, they were too short of the outcome, and the physical activity intervention was moderate by design. Thank you for my presentation.